Thank you for coming to visit me today. This is a role play for Nursing 5382 Healthcare Policy course that I'll be interviewing a Miss Karen Wells, Legislative Assistant to Miss Jane Nelson. Senate Bill 476 was introduced by Senator Jane Nelson and was signed into law in September 2009. I've created this brief that talks a little bit about the Senate bill. Its specific focus is nurse staffing, overtime, and employment protections. It requires that patient care nurses comprise at least 60% of a hospital staffing's committee. The committee will develop staffing plans and report them annually to the Department of State Health Services. In addition, this committee will report directly to the hospital board. Finally, this bill prohibits mandatory overtime policies. My goal in this interview is to hear your thoughts around this bill and to ask that you continue to support bills that will improve patient safety, quality, and nurse staffing. Do you understand how nurses' decisions around staffing can affect patient quality?
Thanks, Mr. Allard. Ms. Nelson's bill was developed and cited current research that has identified adequate staffing having a direct correlation to good patient outcomes. So this bill is imperative that we continue this.
Gotcha. Do you feel that it's important for hospitals to have a staffing plan that is specific to each patient area to meet the needs of that patient population?
Absolutely. It's key that each area focus on a staffing plan that's going to meet the needs of their patient population. This is where patient acuity may also drive how a staffing committee would plan for their patient population in their particular area.
Great. What are your thoughts around mandatory nurse overtime?
Well, mandatory overtime has been a forbidden topic for a number of years. The research has shown clear evidence that nursing fatigue leads to patient safety issues and has a direct correlation to nurse satisfaction.
Gotcha. If you could change anything about the current bill that was signed into law, what would it be?
I really like the law just like it is. There are bills being introduced with the current legislation to look at staffing ratio that may further develop this law.
Do you have any questions for me?
How many staff members do you have on your staffing committee?
So currently on our staffing committee here, we have 2 members. We have a day shift member and a night shift member that have joined the hospital staffing committee for the specific unit. Well, if there are any other questions, I'd like to thank you for your time for interviewing today. It was a pleasure meeting with you and hearing your thoughts on Senate Bill 476. I'll be sending you a follow-up to our interview in summary format of our discussion today, and I look forward to working with you on future bills that will affect nurse staffing, quality, and safety.
Right. Thank you.
Thank you so much for your time.